And then before we get into the data itself, we should probably define what a vulnerable population itself is. And basically, vulnerable populations, it's a broad term, but it's populations that experience a lot of barriers when it comes to healthcare, or a lot of barriers and disparities when it comes to healthcare itself. And that can include people with chronic illnesses, people who are uninsured, or people who just have a general hard time when they access healthcare. And then in this presentation, we're going to use some key terms like SGM and SOGI. SGM refers to sexual and gender minorities, or basically anyone who doesn't identify as straight or cisgender. And then SOGI refers to how people identify when it comes to their sexual orientation or identity. And then we're using this traditionally instead of LGBTQ because that term leaves out people who are gender nonconforming and intersex. And the project that I'm focused on specifically is regarding mental health in SGM populations. I'm pursuing my bachelor's degree in public health, and I'll be finished in spring 2025. And then just a little background just before we get into the data. Here on the top, you can see suicide rates among SGM identifying college students. So the general population, which includes everybody, is around 4%, while sexual minorities, those who don't identify as straight, they see a suicide prevalence of around 11%. And gender minorities, such as those who are transgender or gender nonconforming, they have a rate that is 10 times the general population, so 40%. And then when it comes to abuse in populations that are sexual gender minorities versus non-SGM populations, we can see that when it comes to sexual abuse, any other form of abuse or forms of bullying, their odds are over 100% higher. And then for this presentation, I used data from the California Health Interview Survey. It's the largest public health survey in the United States with over 29 million people surveyed. And at the top in the red bar, or the orange bar actually, you can see that among cisgender adults in California, around 24.5% of them reported that they needed help for their mental health or alcohol and drug use. And then you can see that it's disproportionately lower than the transgender or gender nonconforming population, with 60.8% of them reporting that they need help. And it's a disproportionately higher rate. And then when it comes to sexual minorities and their mental health, we can see that those who identified as bisexual have the highest rate of needing help for mental health or alcohol and drug use, with around 55.4% of them reporting that. And then it's followed by lesbian, gay people, and bisexual, and people who identify as homosexual otherwise, with 42.9% of them reporting this.
Hello everyone, my name is Maria Flores Blancas. I am currently pursuing my bachelor's in science in public health. I am expected to graduate next year in spring, which is really soon. I would like to apologize in advance for not being there with you guys today. I am currently at the HACU pre-conference. My research was focused on disparities in healthcare access. I really hope you guys enjoy my presentation. Current research shows that 1 in 10 people in the United States don't have access to health insurance. Many non-citizens are also limited to accessing federal health programs, so they rely on safety nets. Many immigrants also work in industries that have occupational risks and also live in crowded conditions where they are often exposed to dangerous environments and even to infectious diseases. Finally, data shows the U.S. immigrants use preventive care less than those who are not immigrants. The purpose of my research was to study the association between citizenship status and access to healthcare. For my research, I used the California Health Interview Survey, which is the largest state health survey in the country. As you can tell from this table alone, there was a total of 29.65 million of people in this particular table and survey itself. So looking at this result, among the U.S.-born citizens, 8% had difficulty finding primary care, compared to 7.3% among naturalized citizens and 11.7%, significantly higher among non-citizens. Looking at the same sample size from the previous table, among U.S.-born citizens, 12.9% did not have a usual source of care, compared to 11.2% among naturalized citizens and 27%, significantly higher among non-citizens, where we can see a lack of usual source of care. In addition, on this table, we are able to see the similar patterns exist among the Latino population, where the non-citizens have the highest rate of lack of source of care. In conclusion, we are able to see that there is a limited healthcare access prevalence among non-citizens, including the Latino population. Some future directions to consider is to expand healthcare access through state-level initiative, implement community-level education and preventative care programs, and lastly, increase trust in healthcare providers to improve enrollment for eligible populations. Here are the resources that I used for my research. I would like to thank you for your time and for allowing me to present my research with you today. Thank you.
Hello, guys. My name is Cindy Martinez. I am pursuing a degree in public health here at Cal State, and I am also expected to graduate in spring 2024. I do apologize for not being able to attend. I'm taking an important exam for my phlebotomy course, but I hope you guys enjoy my presentation. My research today is done on association between sexual gender identity and delay in care among California adults. Research shows that 1 in 10 sexual minorities and 3 in 10 gender minorities were refused care by providers due to their identities. Sexual and gender minorities suffer a higher rate of health disparities that include mental illness, infectious, and chronic diseases. My purpose for this research was to evaluate delay in care of SGM adults in California using the largest state health survey in the US, the California Health Interview Survey. In this first table, you can see that among the cisgender adults, 9.2% reported delayed or did not get their medication. And among the transgender or gender nonconforming adults in California, 26.7% reported such delay. In this next table, you can see that adults who identified as gay, lesbian, or bisexual had a statistically significant higher prevalence of reporting that they delayed or did not get their medication compared to straight identity. In conclusion, the results show that sexual and gender identity were significantly associated with delay in care among California adults. Targeted interventions to improve SGM healthcare access are needed, and these can include improving community outreach of health education programs, outreach activities to reduce stigma against SGM population, training healthcare providers to address need for SGM population, and understanding the underlying reasons for delay in medication would be the next steps for this research. And these are my references. Thank you for listening to my research PowerPoint and have a good day.